Hello, my name is Tracy Achi, and I'm an MSN student at Eastern Kentucky University. I would like to present to you a very important topic that many patients with schizophrenia have faced for many years, and that's medication non-adherence. After discharge from an inpatient facility, psychiatric clients often need guidance and structured care plans. Frequently, clients with schizophrenia are non-adherent with their medication regimen. The effect of non-adherence can be detrimental for the patient and others. Increased psychosis is a recurring problem in individuals with schizophrenia and often result in risk of relapse, readmissions, increased risk of suicide, suicide attempts, and suicidal ideations. The Center for Disease Control and Prevention recognized that non-adherence has a direct cost estimated at $100 billion to $289 billion. The purpose of this intervention is to determine the effects of adherence therapy on individuals diagnosed with schizophrenia. The main objective is to minimize medication non-adherence in clients with schizophrenia using adherence therapy. It is determined that adherence therapy in various forms may offer significant benefits in achieving medication adherence. 5 studies were used to guide this proposed intervention. All the studies were all the studies used cognitive behavioral therapy and determined that negative symptoms, including hospitalizations, relapse, suicidal thoughts, or behaviors, were dramatically reduced. Several assessment tools were used to evaluate psychotic symptoms and the resulting non-adherence to medication. The brief psychiatric rating scale assessment was the leading tool used in these studies. The proposed intervention is a 12-month intervention that will take place at West Park Springs Behavioral and Mental Health Outpatient Clinic. The intervention will determine the effects of adherence therapy on individuals diagnosed with schizophrenia disorder using a cognitive behavioral therapy training program for psychosis. The team will include the project leader and psychiatrist. Additional team members will include a member from quality improvement and a therapist trained in cognitive behavioral therapy. In an effort to maintain patient privacy and confidentiality, all team members will obtain city training. The team will prepare for implementation by holding a preliminary meeting to discuss objectives, anticipated outcomes, and potential problems or concerns. The funding was approved and will come directly from West Park Springs Hospital. The study will include both male and females over the age of 18 years and diagnosed with schizophrenia disorder. The therapist and physician will assist in recruiting 16 qualified participants from a list of all patients with schizophrenia by inviting them to participate. Once individuals are selected, the project leader will use the exclusionary criteria to finalize participants. An orientation will be conducted to discuss the basis for the implementation of the program. Participants will be given a consent form. The researcher will review all the questions on the form. Any questions the participants may have will be addressed prior to obtaining signatures. Participants will be made aware that the study is voluntary. No incentives will be offered. All correspondence are private and confidential. Once the consent form has been filled out, the participants will be given a code with a number identifier. The participants will be assessed on their need for the intervention and readiness for change. They will fill a questionnaire pertaining to signs and symptoms of schizophrenia, experiences related to the disorder, medication side effects they are experiencing, number of relapse, hospitalizations, suicide ideations, suicide attempts, and the potentiating factors. After the 12-month study, a post-test will be given to measure and evaluate outcomes. The assessment tools that will be used for the pre- and post-test are the adherence therapy patient satisfaction questionnaire, the brief psychiatric rating scale, scale for the assessment of positive symptoms, and scale for the assessment of negative symptoms. The expected outcome of the implementation is that there will be a decrease in psychotic symptoms as measured by the above scales. In conclusion, advanced practice nurses can effectively deliver adherence therapy as well as skills-based medication training. Thank you for joining me.